Hi, everyone. Welcome to Rare New England's annual conference, Learning from Each Other. My name is Nicole White, and I'm the Executive Director of Rare New England. Today's topic is mental health and rare disease. Thank you again for taking the time to join us this afternoon. I want to thank all of our sponsors, our platinum sponsors, Ultragenyx, Horizon, and Vertex, our gold sponsor, Grail, and silver sponsors, Homology Medicines and Stealth Biotherapeutics. I'll hand it over to our moderator this afternoon, Tasia.
Hello, everyone. My name is Tasia Rachitsky. I'm a board member with Rare New England and also a rare disease patient. I'm excited today to have all of these wonderful speakers here to talk from the many different perspectives about a topic that is very, very close to my heart as a rare disease patient and advocate who has struggled myself with mental health challenges throughout my disease life cycle. So thank you so much to our speakers today, and we encourage everyone and anyone to please put questions into the Q&A, and we will have about a 15-minute section at the end to address any questions. Thank you, and Nicole to introduce our sponsor.
Our sponsor today is Horizon, and our speaker for a representative for Horizon is Michael Salazar.
Thank you, Nicole. Hi, everyone. So as you said, my name is Michael Salazar. I'm a project specialist on the patient advocacy team at Horizon Therapeutics. And I just also want to start by thanking the Rare New England team for providing me the opportunity to be here with you all today. I'm really continually inspired to see the rising focus on mental health in the rare disease community. And I really look forward to hearing some great sessions take place over the course of the next hour. Just a brief background, our patient advocacy team at Horizon, we try to enter each year with like a fresh perspective and come together with a unified goal, center and dedicate our efforts around one theme, weave that kind of into the work we do throughout the year. In 2020, our theme was Year of the Carrier, 2021, Year of Young Adults, and this year we focused on the Year of Mental Health. With this new focus in place, we really had a lot of conversations with advocacy partners and those within the community. And we knew we wanted to find our place to help provide awareness and support for mental health in the rare disease community. And we would soon learn that was much easier kind of said than done. There's a lot of great resources out there, but there's also still a considerable lack of mental health programs specifically tailored to the rare disease community, which, as we all know, it's important to have, as proper mental health support is not a one-size-fits-all approach. It's crucial to understand the individuals and communities in order to properly address their needs. Something sometimes a large mental health organization just sometimes isn't properly equipped to do at that time. For us at Horizon, after learning about some of the lack of resource and research, we quickly shifted our focus and began really supporting creative community-based programming, which emphasized connecting with each other and providing creative outlets. Some of these programs included an art therapy program for individuals with thyroid eye disease, a teen escape event, which brought together teens with primary immunodeficiencies, just to kind of like spend a day together and really learn from each other, but most importantly, to connect and have a good time. We also partnered with and helped provide a program that provided a graphic novel workshop for very young adults. And through all this, we've kind of really focused on doing what we can to support mental health and generate more awareness in the rare community, while also trying to take the time to understand what we can further do. Most recently, we actually partnered with Trend Community, a data-driven rare disease focused company, to help us start conversations and move forward with the facts. So Trend, they've worked with public social groups to engage in social listening in the rare disease community around mental health, learning from the groups what the true key needs are and what the priorities should be. We're really excited about what this kind of data can potentially show and how it can help push forward the awareness, but also how it can potentially develop more resources. Overall, I really want to reiterate, as many of you in the panel and many of you here know, mental health is an integral piece in the rare journey and the quality of life, not just for those with a rare disease, but also their caregivers, families, and their friends. For us at Horizon, we want to try to continue to listen and learn from the community and take the necessary steps to be, whether it be big or small, as we kind of continue to address mental health in the rare disease community. Again, thank you for the opportunity to be here. I'm really excited to hear the conversation today, and I look forward to the progress I know we can make.
Thank you so much, Michael, and thank you for your organization's dedication to mental health in this community. So I'm going to start us off with letting our panelists introduce themselves and their wonderful backgrounds and organizations that they're participating in to get us started. Emily, you want to go first?
Yeah, thank you so much, Tasia. Hello, everybody. My name is Emily Parks. I graduated from Boston University in 2016 with a bachelor's in psychology. I currently work at UCSF in the psychiatry department as a behavioral health care specialist. My focus within rare disease and chronic illness with mental health is medical PTSD. I am somebody that's living with a rare and chronic illness, and it's something that I've experienced personally, as well as something I've heard from a lot of patients, and there's just not a lot of research or support out there. I founded the organization POP, which is dedicated to bringing more awareness of what medical PTSD is to patients and providers and caregivers as well. We're starting off with patients and providers, and it's just making kind of a diagnostic criteria based off of the DSM's PTSD, and then providing support such as resources and discussion groups. I'm very, very excited to be here, and that's all from me. Thank you.
Great. Crystal, you want to go ahead?
Absolutely. Thank you so much. My name's Crystal Barrett O'Loughlin, and I'm the founder and CEO of a nonprofit called Angel Aid Cares. We focus on global mental health support and well-being services for the rare disease community. So we are disease agnostic, and we are mobile first in everything we do. We provide weekly support groups for what we call rare givers across the community. So all patients, caregivers, and professionals who are affected by the emotional experience of living with a rare disease. So while all the good work is being done to find treatments and cures within the rare disease community, Angel Aid is focused on witnessing the emotional impact on the community through support groups. We also do quarterly wellness retreats. You just visit angelaidcares.org. You can join our community there. And then I'll just mention, we also lead the Rare Givers Coalition, which is a community of like-minded professionals that want to develop more open source mental health and wellness tools for all organizations and individuals to use. So raregivers.global is the link for that. I really look forward to this conversation and am very honored to be included today. Thank you.
Thank you so much, Crystal. And all of those links are located in the chat if anybody is looking for them as well. David?
Yeah, thanks. Hi, everyone. My name is David from the UK. I have a rare disease which I was diagnosed with 5 years ago. Since my diagnosis, I've been connected with patients within my own rare disease community, but also patients within the wider community, and became aware of not many men really speaking about what they were going through, talking about their experiences, whether that be a patient or caregiver. So in about 2020, in the summer, I connected with a couple of other males and set up monthly Zoom calls for men to get together, talk about what they are going through, a safe space where they can seek support and know they're not alone with what they're going through. Because I think the mental health side of having a rare disease is something that, particularly for men, it's still difficult to talk about, and it's something that we've got together with. We get together with every month, every last Sunday of the month, and it's been men from all 6 continents have joined. So I think, kind of, despite wherever we are in the world, different countries and cultures, that shared connection has been really important, really, to get together with and share an experience.
Thank you. And last but certainly not least, Kimberly.
Thank you so much. Hi, everyone. My name is Kimberly Steele, and I am coming to you, I think, today from several perspectives. Most importantly, a mom and a rare mom. And Crystal just said rare mama, and I guess that's what I am. I have two boys, Michael and Matthew, both now 12 and 13. At the age of 5, my oldest, Michael, developed a fever, and I took him to the pediatrician with huge concern, and I was pretty much told I was worrying too much. And for a year, we went through a diagnostic odyssey, and he was diagnosed with an ultra rare disease called Kaposiform lymphangiomatosis, or KLA. This is a vascular anomaly, and there's only partial treatments and no cures. My other view to come to you today is through that of being a physician. I'm a bariatric surgeon and scientist, and was at Johns Hopkins for 14 years as an associate professor, and ran the adolescent obesity program there, where teens suffer and live with obesity. And certainly there's a lot of mental health issues from that perspective as well. But today I would love to share with you the perspective of being a rare mom, navigating the healthcare system through the eyes of a physician. I've been on both sides, and I hope that I can provide those different perspectives, because there's parts of me that gets upset with the healthcare system. There's also parts of me that understands the high burdens and stress levels that come with being a physician as well, and trying your best when you're inundated and don't have the resources to help the patients the way that you would like to. So that's me. I guess the only other thing is I did step away from my career right now because I saw a huge need in the rare disease community. And I have now partnered with the researchers and scientists to help them accelerate research in my son's disease. And I was sharing with the group here that I've just started my own nonprofit with the only motivation of writing grants and helping our entire community. And the nonprofit's called Caravan, Collaborative Research Advocacy for Vascular Anomalies Network. And it's a way to bring, I hope, vascular anomalies groups out of silos and working together, because we are stronger together, to find improved therapies and ultimately a cure. So thank you so much for having me today. And thank you to Emily for this great invite.
Thank you so much, Kimberly. Well, we certainly have like a wealth of knowledge here, so I'm excited to jump right in. As discussed, a lot of the time we talk about the medical or physical burdens of rare disease, often financial and social aspects, but sometimes, mental health kind of takes the back seat. I'd love to hear from our panelists, why do you think that mental health is so important and shouldn't be overlooked, especially when dealing with rare and complex diseases? And why do you think it may get overlooked at periods in time?
I can go ahead with that one. So I think our healthcare system divides physical health and mental health. Psychiatric help, definitely the science behind it, developed later than physical health. And so it was kind of seen as this sub specialty. And then as medicine or, remedies for physical health accelerated, we were still learning about how the brain, is composed, what the brain's composed of, what different parts does what. And without that, we wouldn't know mental health. And so I think it was kind of put in the silo. And for some reason or another, it stayed in that silo, and we're not at the point of integrated healthcare. there's little bits and pieces that we're seeing it more, such as PCPs or primary care physicians doing depression screenings more often, teams, referring to psych more often, but there isn't a full integration of, how does physical health impact your mental health, and how does your mental health impact your physical health? They're still seen as very separate, almost like there's, the cardiologist, there's the guy for your lungs, and then there's, the psychiatrist, when really the brain is in everything. How we feel is in everything we experience, and it's just not brought into a full conversation when the team is, roundtabling on a patient.
Absolutely, Emily. And I'll jump in. Having spent 50 years witnessing what's been happening in the rare disease space. So if we pull back the lens and look at some of the forces on rare disease, we used to be every individual disease sort of for themselves, right? In terms of generating support, in terms of finding treatments and cures through individualized research. And it's only been the last maybe 10, 20 years that we've started identifying as a community, right? And in doing that, we've been able to impact legislation so that we get more support for the rare disease community, both in terms of research and science grants, but also it's focusing us on this collective consciousness of what is going on across everybody's common experience. And the mental health and wellness is just as impactful on the family. So we have this focus on patients and patient-driven drug discovery, but we're realizing that we've got to pull back the lens a little bit and look a little more holistically at what's happening within the family, because families are falling apart. That is the reality, right? All the rates of divorce are higher, the rates of addiction are higher, the rates of poverty, the impact, the financial impact, everything hits a rare family harder than it does so many other families. And so that holistic point of view is really important. And we can learn a lot from other communities, military and veterans caregiving, senior caregiving. We can learn about that sort of whole family health and wellness point of view. We don't have to create it all in rare disease. We just need to take the best of what's already out there and bring it over into our world. So just another point of view.
Yeah, thanks for sharing that, Crystal. Yeah, I can relate to that. I think from my own experiences, whilst my daughter doesn't have the same rare disease as me, she's lost her gran to the same rare disease that I have, and my nephew to another rare disease. So we're kind of hanging on in there, but we struggle and still are struggling with the impact of it. So yeah, I think kind of for me as well, I think kind of whilst we wait for treatments and cures, it's kind of like it's becoming more and more important, I think, to look at the support needed for people whilst we wait for these things. And I think that gets overlooked because it's not straightforward, it's not easy. But coming back to kind of my men's group, it's kind of like I'm more hopeful now than ever, because now I have a small community of guys from around the world who are kind of we're connected and we're sharing what we're going through, and we're kind of like, I don't know, I still think there's a way to go with like breaking that stigma for men to kind of talk about their mental health. But I'm hopeful, because I think it's been going for, my group has been going for over 2 years now, and whilst there's still more that could be done, and there's still other men that for various reasons aren't able to attend, I think it's really important to really keep going with what we're doing, because I think it's needed, especially for some of the experiences with that the men share in my group.
So I guess I'm last here to chime in, but I think you've all given me some aha moments to if I look at this from the physician side, having again navigated it as a mom, because Crystal, our family has gone through every single thing you've mentioned, whether it's worry about my son as he moves into teenage years and dealing with this rare disease, whether it's my husband and my relationship and how much stress it puts on us, and figuring out what treatments we do, etc. And then from the physician side, understanding from the physician's perspective, again, we don't have the resources. So to understand in the academic setting, we are given this number of patients that we must see. And if we don't, we get sent to the chair's office and reprimanded for not seeing enough patients. So how does that help us with the importance of even adding in mental health or spending time with our patients? So my aha moment here was the rare disease community, every community needs to speak up, and we need to include this in our education of our medical students and our administrators, the more importance that mental health brings to our holistic care, right? That just as Emily said, how does mental health impact physical health, and how does physical health impact mental health? They go hand in hand. So in medical school, for example, now there is attention on well-being of the medical student because there's so much stress in being a medical student. I think next, though, there needs to be attention on mental health for our patients, and that in every different type of disease or system in our body that you go see a patient, you go see a doctor, that we be aware that mental health impacts disease as well. Just to bring that up, I work with groups of medical students that are starting to be involved with rare disease, and they're creating these rare interest groups, which is awesome. And I think this will be a topic now that I can bring forward to them. But for people out there, the more that we speak up, the more that this will improve. So, and kudos to David for bringing up about men and bringing up about mental health. And we see that in bariatrics and obesity as well. It's 80% women who show up for treatment, 20% men. So this is in every disease, whether it's common or rare.
Another thing that kind of popped in my mind, both when Kimberly and David were talking, is that there's a supply and demand when it comes to psychiatrists, psychologists, any kind of provider, caseworkers, social workers. And so that makes it even harder for patients to get psychiatric treatment, and providers who are experiencing burnout, the high stress, especially associated with all the deaths that happened during the pandemic and long COVID. And so it kind of forces to pick and choose what patients are chosen for psychiatric services. And so there simply isn't enough providers, which makes it tricky as well, getting the services that you need.
Absolutely. Thank you so much for those thoughtful responses. I especially, that education piece and kind of informing the entire community, which includes providers and medical, even all the way down to medical students, of mental health being so important. Obviously, each of you are coming from a different perspective. You work with different groups of people. You specialize in different areas, even within the broader mental health realm. What do you find to be some of the hardest or most frequent mental health challenges that you see or you experience as a patient or caregiver or family member or in your communities?
I don't feel heard.
I
Listening,
I was
understand.
isolated, even with all of the advantages I had of being a physician and being able to reach out to who I needed to. I still felt alone and isolated and scared. And until you find your community, it's really tough.
Also, I think the system can be complicated in getting support for some. I've heard that not straightforward, and I know in some cases it puts people off seeking help, but it's not easy to get help anyway.
There's this is Crystal, there's an amazing article in Psychology Today and I'll pull it so that you can, Teja, so you can share it with everybody. But it talks about the different kinds of support, because I think sometimes we're talking past each other. Oh yes, we're providing that support. But the Psychology Today article breaks it down into 4 different kinds of support. One is information and tangible support. What is the disease? What are the symptoms? How do I do symptom management? How do I find a doctor? How do I get coverage for my insurance claims? How do I get durable medical goods or guidance on how to alter the home, right? So that's kind of like the triage list of things that need to be done within the family in order to support that patient loved one. That does not bring relief from a mental health and wellness standpoint. What brings relief from a mental health and wellness standpoint is emotional connection. It's being acknowledged that that long list is having an impact on your feelings, right? And the companionship in the experience. Again, we're not fixing the core problem. We haven't actually found the treatment or the cure yet. We haven't solved the core issue, but we've witnessed, we've acknowledged that it's hard, and we've held your hand, offered a hug, looked you in the eye and asked how you're doing. And ironically, in the Psychology Today article, it talks about, and this is rare disease specific, it talks about what brings relief is actually the emotional support and companionship more than all of the other things that we're all trying to provide in terms of support, right? So I loved, Emily, what you called out, which is we have a challenge here. If everybody needs emotional support and companionship, we can't provide it necessarily professionally one-to-one. There's not enough psychologists and social workers and professionals to be able to meet that need. We need to provide that need as a group. In just bringing community together, we can do 80% of the work just by witnessing in each other. And David, you've been proving that out, right? By bringing your groups together. The one thing that I caution, or at least want to recognize or have you really think about, is that when you're joining into disease-specific support groups, the focus is on the patient. The focus is on how to manage that triage list, the information and tangible support. Very rarely is the focus, there are exceptions, and there's beautiful exceptions, but very rarely is the focus on your emotional well-being, your feeling of connectedness, right? You're sort of living in that triage list instead of living in the heart of being witnessed of, oh my gosh, this is really, really hard.
Kind of go off, Crystal, thank you so much for that answer. That was beautifully constructed. And to go off a little bit of what you said with that, it's not so much seeking a provider for that emotional support, it's within, us to do that for each other. I think there's this kind of, knee-jerk reaction to fix the problem. And really, a lot of people just want to be heard. And so, each of us, and this is within the rare disease community, but this is also, to operate with your friends, with your family, with anybody, is active listening skills. Sometimes it's so powerful just to sit down and shut up and just listen and just say, wow, that's really hard. And really just understand the problem. A lot of times people aren't looking for a solution when they vent, they're looking for somebody to hear them. Another thing for all the providers in the audience is, you can afford a little bit of time to listen, and then also communication. There's nonverbal communication and there's verbal communication. And with the nonverbal, that can be like, leaning against something, sitting at the same, eye level, making eye contact, softening your posture a little bit. And the tricky thing about communication is that it sounds easier than it actually is, but it's not as hard as you think it is. It is a skill set on its own. It's not an act. And so having those kind of pauses in communication to let people in, listening to each other, using I statements, almost like you're a project manager of your own healthcare and saying, this is what works. I'm not sure if that works. This is what doesn't work. And also doctors not being afraid to say, no, that sounds really difficult and I don't know the answer, but I'm here with you. And that all could be very, very powerful in patients' mental well-being, and also just building rapport, better treatment outcomes.
Absolutely. Yeah, and going back to kind of what Crystal said, I, as a rare disease patient myself, and as someone who, especially in my adolescence years, struggled with kind of that mental health aspect and kind of didn't even realize it, right? Because I was so consumed with, I think what Crystal is considering that checklist, right? Like I was so busy and consumed with medical appointments and hospitalizations and procedures. And I was going down that checklist being like, okay, I have this and I've done this. And it took time for it to set in. And I didn't even recognize that in the background, what was happening was I was mentally struggling and unable to, communicate or even recognize my own emotions around having a rare disease. And so that happens, I know, a lot to more people than just me, that they don't even recognize that they have a mental health struggle, or even if they do, they don't know where to turn or how to seek that help. What are your suggestions as people who are out there in these communities working on the ground?
It's quiet, so maybe I'll start. I didn't know. It's so, like, as a physician, I didn't know where to look. I was, again, like you said, that I was so focused on getting the care for my child, I didn't even think about myself or what my son needed. It was like straight ahead. We got to find a diagnosis. We've got to get him better. And that's a shame because it builds up on your person and on your child too. So one thing that we used, which was really helpful, was Child Life. They were incredible for us. And Child Life, there was one person there for Michael at all times, and also for my younger child. And then they suggested to us that we get psychology involved, which was really, really helpful. So we were lucky because at Kennedy Krieger, where we are in Baltimore and Hopkins, we were able to get the kids in quickly. For myself, I wasn't able to really find community at first. And again, that felt so isolating. And me not being a social media person at all as a physician, like nothing, my husband started turning to Facebook, and we found people through social media. And those groups are really fabulous for support. I caution people too, because as a physician, there's stuff there that I read and I like gasp and I just want to be able to help them. So always remember that you need to check with your physician before you do some of these things, whether you believe in your physicians or not. It's really important. But overall, it was helpful to find others, that parents that were going through what we're going through. And now I face transition, right? My child is no longer a child that needs me. He's becoming a teenager. And I think I need more support now too. And how do I help him as he transitions and takes on the responsibility, and even deals with the fact that he has a chronic disease?
Yes, and Kimberly, thank you for outlining that, because this journey with rare disease is sort of phased, isn't it? It's sort of, you're in that first stage of recognizing that something's wrong, something's not right, and then you're going into, you know, another phase around the diagnostic journey, which we've all heard so much about. And then you kind of shift into, you know, the realities of caregiving and the dynamics within the family and how the family reorganizes in order to support the needs of that loved one. And in a fifth and sixth phase that maybe isn't often talked about, but is a reality for so many in the rare disease community, is the end of life experience, the palliative caregiving and the end of life experience. And as parents, as the leader within the family, whoever that lead caregiver is, you're often put in a position of needing to guide the emotional needs, not just of yourself, but your loved one and everybody else in the ecosystem, right? All of the extended family members, and really even lovingly educating doctors and nurses and the professional community that's supporting you. So there's a lot of pressure on that individual caregiver. And you talked about asking, you know, resources and where do people go. And I encourage everybody listening, and I keep talking about this, you know, every single week, there's an opportunity, is try to pull back the lens if you can a bit, because there is some commonality in this experience across rare diseases. And there are umbrella organizations that are really trying to address this mental health challenge for everybody, right? So organizations like Rare New England, Global Genes, NORD, Eurotas in Europe, right? And there's others around the world. Angel Aid looks at this from a holistic point of view, right? And so, so when you're looking for support groups and you're looking for support, think outside your specific rare disease and think about how you can connect. You know, one of the things we hear, and we host weekly support groups. So week in and week out for 4 years, we've been talking to rare mothers, rare fathers across all rare diseases, right? And the one thing that they say, it's such a relief to set the disease at the door and step into my needs and my emotions and my experience, right? And so if you can find a group like that, it can be very cathartic. There are also individuals within the hospital, the social workers, you mentioned Child Life can be a conduit into, you know, we're establishing partnerships. We don't need to build a network of mental health professionals. They already exist. NAMI, National Alliance of Mental Illness, Mental Health America, these are all resources, and you literally can get into like a 12-week, 30-minute for free, you know, engagement with someone that will just listen without judgment, right? With NAMI, you can just call up your local NAMI office. Now, they will not have the perspective on rare disease. They're not going to understand the unique experience that you're going through, but 50, 60, 70, 80% of what you actually need is to be listened to be witnessed, to have that outlet for sharing, right? So be creative, I think, is the answer. And then always come to Angel Aid. We're here for you as well.
Yeah, thanks for sharing, Crystal and Kimberly. Yeah, from my perspective, from connecting with men, I think kind of there is a thing with men wanting to be the still kind of like the fixers, the providers in society. I think when your child is diagnosed with a rare disease, it's a temptation. I'm going to find a cure and kind of raise awareness. Or I'm a man, I've got a rare disease, but I still want to carry on with the best I can. But I do think it gets, it will catch up with you, the weight of it all, appointments, your health, normal life kind of expectations and responsibilities. So I would say personally, I think despite different rare diseases, there are some commonalities. And I think for me, obviously, I would say as a peer support group would be beneficial. But also from my own perspective, I think counselling hasn't always worked in the past. But for me, the last counsellor I've had has worked really well. And I benefited a lot from that when I lost my nephew. So also, if you've got people that you can talk to, whether partners, family or friends, not every man who comes to the group has that. They're kind of, some of them are isolated, almost forgotten about in a sense. So I think there are a number of options, whether that be online or kind of in person, that you can kind of look into. I think it's finding the right thing that's personal to you.
I just want to also say, Crystal, I love that idea of stepping out of your isolated group too, because while you feel isolated and you want to find your people, and it's important to have your people, your community, it's also important to just find others that are going through similar experiences. And it has been so, I think, emotionally good and enriching for me to meet other rare moms that may not have the same disease, but are sharing very similar experiences. We did a project with medical students and 2 different rare diseases, and we asked the rare disease community the exact same questions about issues that they're having. And, you know, the issues were identical, right? And so I love that I guess motivation and idea, Crystal, to step out, find others, and love the idea of this Angel Aid. I didn't know about it till now, but these are the kind of things we need to do because we are so much stronger together. And yeah, it's just, I think, important. Yes, we need our communities, but we shouldn't be siloed and think that's the only place we can get support from.
So like others said, there's a kind of like rush of, you know, what to do next, the checklist, what to address, you know, this surgery, this appointment, these medications. And it's quite normal to kind of go through that and then in the background, slowly be processing what's happening. And this is kind of a form of, it's kind of a coping mechanism of the trauma that can be with chronic and rare disease illness. Not saying that it is a traumatic experience for all, but it can be for some. And so we're slowly processing in the back, and it's almost like our lizard brain in the back is more of like live, do what we have to do to survive. Whereas our more rational brain, once the lizard brain is appeased and it's like, okay, we're gonna live, you know, things are fine. That's when the rational brain gains control again and can be like, whoa, what is actually happening? You know, and kind of start to soak in the emotion and the experience of having to go through you know, treatment for a chronic and or rare disease. And then not to mention how chaotic our healthcare system is. David, I apologize, I don't really know the healthcare system in the UK, but I know it is messy here. I hope it's a lot better for you. But and so, you know, just don't be afraid to get curious. For me, and realizing my own medical PTSD, it wasn't until after I got a transplant and things started settling that I was like, I can actually, you know, sit down and think about this. Because previous to that, I was taking care of myself and just kind of running with the emotions, running with where my, you know, frantic lizard brain is telling me to go. And so it's quite normal to kind of like have these emotions kind of be muted in the background. And then once the dust settles, then they start pouring out. And so, you know, if you're wondering, maybe, you know, maybe what I'm feeling is normal, maybe it's not, don't be afraid to, like, you know, shop around different organizations, ask questions. For medical PTSD, there's been a lot of folks that said, you know, I never had a name to describe what I was feeling, but this is it. And so just don't be afraid to investigate. And if you're like, nah, this is not me, then it's not you.
Yeah. And I know we're going to move on to the next question, but I just have to jump in, Emily, because in the mental health world, in the sphere for professional mental health support, the line item that is covered for the insurance company is PTSD support. That is the code that you need, right, in order to get those sessions covered. But it really isn't the experience in rare disease. Post-traumatic stress disorder, this isn't an event and we're now recovering from it. We are actually in what I call a CTSD scenario.
Complex.
It's chronic.
It's
well,
ongoing.
I call it chronic. It's a chronic traumatic stress response because it's ongoing. It's every day, and it could be for weeks, months, years, decades for many in our family. So there isn't a line item for CTSD support. But what I will say is this: the approach to handling and addressing CTSD is different than PTSD. It's the holistic health arts. It's the ancient arts that bring relief in a chronic traumatic experience, right? It's things that we know that we should do to sustain our health and well-being, to eat well, to exercise, to ensure that we're getting sleep, to ensure that we're connected with somebody that cares about us, that isn't trying to fix, right? And the ancient arts like yoga and meditation and sound therapy, right? So there's so much that we can do. That's why we talk about being mobile first. There's so much that we can do to actually just acknowledge, like, this is I'm in this chronic state of stress, and what can I do in little micro moments a day? Not 4-day wellness retreats somewhere, even though we offer those. You know, not everybody can get away, especially Kimberly, when you're in the acute stages of caring for a loved one at home, you can't get away. But you can reframe your coffee ritual in the morning and take 3 deep breaths while your coffee is brewing. And you can make sure that you do walk and talks throughout the day, whether it's business or personal, right? So I just felt like I need to jump in because we're talking about all the doomsday and the difficulty, but there's so much that we can do that's available to us.
Well, thank you so much. Yeah. And I was just thinking now, grounding exercises, feeling, you know, the chair beneath you, the air around you, things that, yeah, like you said, only take a couple of moments, and it's just like, bring me back to here, bring me back to here.
Yeah, I really appreciate what you're all saying too about like making and finding what works for you, right? Because it's really not a one size fits all. And also combining different aspects, right? Professional help combined with peer-to-peer support, combined with different wellness activities. And just to add my opinion, I would say to like definitely keep an open mind to what may work. Crystal's comment kind of brought up to me, you know, I was always the type of person, I was like, yoga, like that, no, that's just not for me. Like, it's not going to work for me. Like, I don't think. And little did I know that as a person whose just brain constantly runs at 1,000 miles an hour and is overwhelmed with like we were talking about, just surviving on a day-to-day basis and all the things I have to do that have to line up to make that happen, that, you know, yoga was my way of just kind of bringing my brain down, right? Like having a moment in the day, and not a very long moment, but like a time where it can just shut off and not think about those things. And having that be something that I looked forward to, and that really kind of did help my overall well-being. So I guess I'm the picture child for, yes, keeping an open mind to what potentially could work for you or people is going to look different. And, you know, one thing will not work for everybody, but finding that thing or that combination of things that really can support your mental health. So we've kind of alluded to it in this conversation and, you know, talked about it to some extent, but, you know, let's talk about the stigma that kind of surrounds mental health. I guess my question to you is, do you think there is one? And where does that stem from? You know, we hear stories about patients who fear things like being labeled as psychosomatic or being medically gaslit in their experiences. And these have a way of compounding on top of their already traumatic experiences that they're having. Why do you think that happens? And what can we do as a community to move away from that and move in the right direction? A very simple question to you all, I'm sure.
I guess I can start from the physician perspective again. I don't think it's taught in medical school to really listen and believe the patient sometimes. We on rounds, again, we're so busy and there isn't time, and it's a culture. And again, and it's sad because I experienced it myself as a parent, being told that my child's symptoms were behavioral and maybe he didn't want to go to school. And I kept crying out for help, saying, no, there's something not right. Something is wrong. And it took a whole year of 12 specialists to finally say and figure out what this was. So I think we, again, as a rare disease community, need to speak out to the administrators and medical curriculum. And yes, well-being for the medical students is very, very important, and we need to teach it, but we also need to teach the importance of not pushing patients aside. And when they are constantly complaining, how do we address it? How do we listen and not gaslight them? It's a good word. And I also think, just to put it out there, for parents who have kids, that there are resources at work to help too, to support them, and not just put that aside as well. It was tough trying to manage a child who was not well in my surgical career. Just the two of them did not work because I didn't have enough support.
Absolutely. So I know we're coming up on time here. We want to respect everybody's time, including our webinar participants and attendees. Thank you so much. Thank you all so much for being here. I'm going to pass it over to Nicole for our conclusion.
Thank you, Tasia. Thank you for moderating this wonderful talk, and I really appreciate our great speakers today. This conversation was definitely needed and so important. I wanted to thank again our sponsors for helping us make this event happen: Ultragenyx, Horizon, Vertex, Grail, Stealth Biotherapeutics, and Homology Medicines. I also wanted to mention our career fairs. We have one coming up on November 15th. We also have our Rare Disease Day speaker series coming up around Rare Disease Day in February. And we also have our Rare Connections for Caregivers support group coming up on November 8th. So we'd love to have everyone a part of that as well. So thank you all again for joining us this afternoon, and we really appreciate your time. Thank you again from Arnie.
Thank you, everyone.